Welcome to another episode of Harbor Rock Wealth Management's podcast series, Life, Health, and Wealth, where we discuss financially driven topics and how they relate to our financial lifestyle. This is Ruben Smith. I'm Jimmy Lester. And today we have Carlos Aguilar back for his second round in the hot seat.
Thank you, gentlemen.
Welcome.
Good to be here.
Yeah, happy you're here.
His business is 3G Health Insurance Services out of South Orange County. And we took basically a dive on health insurance, Medicare, and just kind of went surface level last time on a few things there. And now we have him back to dive into Medicare specifically. Carlos's Super Bowl, Heavyweight Championship, World Series,
Stanley Cup.
Busy season, yeah.
Tis the season.
It is.
And Carlos is here to be a trusted contact, friend of the show, and friend of Harbor Rock.
Absolutely. Thanks, guys.
So last time we talked about your glory days on the basketball court at mission school. And we had a couple friends. Now, we only graduated with like 21 people in this class, roughly.
Correct.
Maybe 20.
3 at the most, 23.
And I did get some of them watched the show, and I did get some feedback, and they thought I was embellishing at mission school.
Oh, boy.
And
Here we go.
I had to reassure them that, look, I was on the court with this guy.
Are you giving
He was
names?
a legend.
Who'd you talk to?
KS is a initials of the female sort, and I know you know who that is. So we'll have
Wow.
It just hit.
That's my son's godmother.
It just
Okay.
hit.
She loved the show, and she thought you were awesome, and I reassured her of your ball handling skills on the court.
That is
so.
hilarious. Okay.
You got a call to make, huh?
Okay.
Yeah. I'll see you at 12.
Yeah, right. So I also, of course, have a promised stat of the day, as always. And on this day in sports history, Michael Jordan retired in 1993, relatively young. He had some success in his career, of course, quite a bit. And he retired in, he came back to the Bulls in 1995. He returned. And then he went on to win 3 more championships. Just played a little baseball. He was following his baseball dream for a minute. Played
That's right.
St. Paul Saints and the White Sox.
The Barons.
Station.
Yeah.
Okay.
Birmingham Barons.
Birmingham, I think, yeah.
Played a little indie ball then with the White Sox minor league team. So I think he had enough of that and realized it's really hard to hit a slider.
Yeah.
And he came back and won 96, 97, 98, 3 more championships, and then retired again in 99. So.
Wow.
I was going to ask you if it was for the first time or second time,
He was
but
a 2-timer. He was like the Tom Brady of basketball.
And do you folks know who won the championships when he was retired?
Oh, man.
Was it the Lake Show?
No. So if I'm not mistaken, it was the Houston Rockets.
Oh, with Elijah?
Hakeem, yep.
Yeah.
So he wins 3, he retires, they win 2, he comes back and takes 3 more.
There you go.
Awesome.
So had he never retired, would Hakeem Olajuwon have won 2 titles?
I don't know.
I don't think so.
No, but he would never have been able to wear number 45 on the baseball field
That's
either.
true.
So,
That's true. And he wore 45 on the basketball court too.
when he came back, right?
Yep.
Yeah, that's right.
And I think in '89. So what other jersey did Michael Jordan wear in the NBA?
In the NBA. The Wizards. Did
No,
he play
right.
for the Wizards?
He did. No, right. But the jersey number.
Oh, I don't know.
So his jersey was stolen before a game, and someone threw him a Chicago Bulls number 11, I think.
Really?
And it's on a basketball card.
From the
1989.
stands?
1989. No. So one of the
So one of the guys just
one of the
threw
guys
him
just said, "Hey, here, throw it on," and
That's awesome.
he's wearing, I think, a number 10. 1989 Hoops basketball card has it on it.
Cool.
How funny.
Yep.
awesome.
Nice.
So
Well, good stuff.
I also have a yogiism, of course, and we're coming into baseball playoffs. It's a great time of year. Great time of year for sports. Baseball playoffs, football's in full swing, basketball's right around the corner. Got a chili cooking on Sunday. So this yogiism, love is the most important thing in the world, but baseball's pretty good too. So I saw that one, kind of laughed. And,
That's a good one.
And I wholeheartedly agree. Love is the most important thing. But so shifting gears.
yes, sir.
We're back to talk about Medicare. Give me a 101 on Medicare.
Absolutely.
Let's just strip it all back, go high level. Tell
Okay.
us about Medicare.
So Medicare is obviously insurance, typically for seniors, but not always. So let's say somebody's in their 20s and they've been deemed permanently disabled. After 24 months of receiving payments for permanent disability, they will actually trigger Medicare also. So it's not always just seniors. Another thing, too, that people always wonder is, do I need to start my Medicare at 65? the question is, well, it depends. If they have employer coverage, then no, they don't. You need to have credible coverage. As long as you have credible coverage, then you do not have to start Medicare. But if you're self-employed or you don't have insurance through a company, then yes, at 65 years old, you should start your Medicare. Otherwise, you can be penalized in the future.
I was going to ask you, so if they don't, as long as they have coverage through an employer, they're not penalized for, say, starting at 67.
Exactly. No.
Okay.
So, and that's one of the biggest calls we get, or the questions is, well, do I need to start my Medicare, and what's the penalty if I don't? And for your information, the penalty is for Part D. So this goes off of your premium. It is 1% of the national average for every month you don't have coverage.
Oh, wow.
So let's just go with easy math. So 1% of $40 is 40 cents,
man.
right?
You got me. Yeah,
Well,
I wasn't ready for math, man. Yeah, what happened
So
there?
40. So
Give
let's
me
go
my
with 40
calculator.
cents. 40 cents. So in a year, it's $5 in penalties
Okay.
that you'll be hit with, though, every month for the rest of your life.
Wow.
Oh, it's not just to.
It's not
you
a
don't
one time.
Fill up fill in the gap there.
No,
what you missed.
no.
Oh, wow. Okay.
So
I
let's
gotcha.
say that individual goes 4 years, and they may have coverage at work, but the drug coverage is not deemed like minimum essential that the government expects. That's not credible. So they will be hit for those 4 years. So that's $5 a year. That's $20. So if they have a $20 premium on their drug plan, now it's $40 the rest of their life because they didn't enroll at 65.
Wow.
Yep.
So basically, do your homework. If you're approaching 65, get in front of either do your research, get in front of an insurance agent or licensed agent. Like
Absolutely.
Carlos here to help you out.
Yeah.
Wow.
For sure.
Wow.
And
For
then
sure.
we got some important dates coming up.
We do.
What's going on?
So October 15th, so we're 9 days away. October 15th is the start of the annual enrollment period, and it runs through December 7th. So those are the 7 weeks where individuals already on Medicare can research and change their plans. So as of October 1st, we're able to discuss plans, but we can't do an application until the 15th.
Gotcha.
Yep. And it won't take effect until January, though. So that's the other thing to consider is a lot of folks think, well, hey, I submitted the application with you on November 1st. Does it start today? It doesn't.
Right.
So their current insurance will run till the end of the year, and then the new plan starts in January. So don't use, if the new card arrives, don't use it. And if you still have your old card, then that's what you use till the end of the year.
Gotcha.
So
And we have, well, being self-employed now, we have also open enrollment coming up. When do you recommend those not
Sure.
on? Yeah.
not on Medicare. So
Yeah.
individual health insurance for families and individuals, it also starts on the 15th. But what I always tell folks is wait till November 1st.
Okay.
And even Medicare, it doesn't make sense to jump and be one of the first people on a website or anything else because, as you know, information can be incorrect, and then they notify the carriers, they notify folks to correct it. So you might be enrolling yourself on information that's not accurate.
Well, it's also, this is an important decision. Whether it's Medicare or for me, I have a family. I want to make sure we're selecting the right coverage. For someone maybe in retirement or Medicare eligible, it's a major decision because it's not something that really can be
Undone.
Yeah, and you're stuck with it for a year. So make sure you're
Yeah, it's around your healthcare and it's financially impactful.
sure.
It's both. I mean,
Exactly.
Yeah.
No, exactly. Well, and the thing that I always try to teach clients is just what you said, that the fact that this decision they make is going to impact their new year, and then also when they can change. So depending on the situation, so individual or Medicare, I mean, if you moved out of the county, right, I mean, that would give you the ability to change your plan again. So as we know, when we're talking to people who are retiring, they're looking at moving out of Orange County.
Sure.
They might be going to Arizona or Texas, Montana, Oregon, you name it. So if we know that information ahead of time, I can put them on a plan and say, look, remember, this is for the next 6 months, January through June, and then you know that you're moving, and then we can look at something out there.
Right.
So, and on top of that, too, understand that the cost of Medicare, not what you pay for A and B, which we'll discuss, but your actual insurance plans are different based on the zip codes you live, right? So if you tell me that you're looking at 3 different counties in Arizona, talk to me. Let's discuss. Let's find out what your healthcare options are. Because if you're in love with all 3 and you're fine living in Flagstaff or Sedona or, Tempe, wherever, it might come down to what your insurance options are, or
Interesting.
hospital accessibility, right?
Right.
I mean, you don't want to be somewhere where the nearest hospital is an hour and a half drive.
I guess, yeah, that opened my eyes. It's not just blanket coverage. It's not, okay, I got it. Yeah, I signed up. I have Medicare, and now I'm moving across the country or even out of the county within the state. It's
Right.
You still got to keep an eye on this coverage.
You do. And we'll talk about those options too, because depending on what you choose, it can be kind of blanket coverage no matter where you go. But it will change your premium based on where you live still.
Wow.
So, absolutely.
Crazy. What's a good, I mean, obviously there's probably a website specifically to go to.
Sure.
What's the most reputable place to find some information about?
So, Medicare.gov. Medicare.gov is what I use. Medicare.gov is what I recommend to my clients. And it's very easy to navigate. And you go to find a plan, you put in your zip code, you put in your medications, and it will tell you all your options on Medicare Advantage plans. So I think I was saying earlier, Medicare Advantage plans, there's 68 this year. They're going to 78 plans next year. So it will give you the plans in order of cost based on premium and what you pay for your prescriptions.
So the good news is there's a lot of options. The bad news is there's a lot of options because that can also
Right.
be confusing.
It
So,
could.
so you're recommending clients that are comfortable with it going to the Medicare website as opposed to filtering through all the mailers they get.
Oh, absolutely. Absolutely. Because as you know, those mailers are sales material.
Solicitation.
Right? There's solicitation, there's sales material. Each one is saying that this is the best plan for you.
Right.
But when you go to Medicare.gov, they're showing you the best number 1, 2, 3, all the way down to 78.
Yeah.
So based on your specific conditions, specific medications, you will know which ones are in the top 3, 5 options. And then that's where you involve the broker, because we needed to go and find out, are your doctors in network? Just the strength and stability of that plan, and just maybe some of the things that we know on the inside that could help them make that decision.
Right.
So.
Right.
So that's a good shift where having an agenda, when usually you say you have an agenda, it's a bad thing. From what I know about you, your whole agenda is just trying to find out what's best for these individuals. You're not pushing a product here that, as a matter of fact, if you know, the more you know about these people and the better their experience, you're building relationships for life.
For sure.
And so speak to that a little bit more about your approach. I know we basically touched on it last time, but reiterate to our clients, especially as a trusted contact at Harbor Rock, what's your approach in going through this process to find out the best choices for these people?
Right. So I think the big thing is listening, understanding exactly what their specific needs are. And it's amazing that once you let somebody open up, they start saying a lot, right? And then that's where you just start taking notes. And then I always tell folks, I'm trying to educate them so they know exactly what is good for them, not asking, so what do you think I should do? I want them to know what they should do based on the information I gave them. And in a way, it's kind of funny because I feel like I'm selling myself out of doing the business, right? Mm-hmm. I'm making them the expert, but with the idea that you still want an advocate. You still want someone who's going to be there for you. And these things change. Year over year, things are changing, and I'm always studying it. We need to do continuing education units. I'm licensed in multiple states. So I'm always learning and educating myself on what's out there where they aren't. So what I told them today will still be applicable, but there's going to be changes that they need to come back to me and say, so what do you think now? I understand this happened. Earlier we were talking about Inflation Reduction Act, right? Mm-hmm. And I said, how has that affected your business? Well, with me, it's no different when they did the Affordable Care Act. Affordable Care Act made it to where they had to cover anyone with no exclusions to pre-existing condition, which made everyone else pay a little bit more for their insurance. Now, right. Honestly, some people don't like that, but it's probably the right thing to do because it's covering folks who need help, right? So same thing with inflation reduction. In 2025, there will be a maximum of what you'll pay for prescriptions, which is $2,000. Right now, there's drugs that cost $2,000, $3,000, $4,000 a month. So that means that in 2025, that person will never pay more than $2,000 for the year.
Right.
So that money gets spread across some of us to pay. But again, it's probably the right thing to do because these folks are struggling. They have to choose whether they're going to take a medication or eat tonight. And that's not right.
Well, yeah, it's like, do we have a right to health care? And we don't have to get into the politics of that, but that question's posed all the time.
Sure, yeah.
Yeah.
Yeah,
Well, going back to what you were talking about as far as educating the client and getting them, trying to get them to be an expert in this as well, I think of that as having them engaged in the process. You know, it makes our jobs as advisors so much easier when they're engaged and they're coming to us with questions because they've already done their research and they've done their due diligence. Yes, they could probably go do it on their own, but they continue to work with us because of the advocacy piece. And when push comes to shove and they really need assistance or they have a question that they need something done or a need that needs to be done timely, we're there for them. So we built that relationship, we built that trust, and to me, it seems like a no-brainer to work with someone in your field because we don't know when life will happen, when they'll need you. You mentioned last time, I think someone received out of the blue that they've been dropped from their insurance coverage.
Absolutely.
So do you want to save that client a bunch of time on hold and trying to figure out what happened? You know, I mean, that it just seems to be, you know, advocacy all the way through in your job. So
and I'm sure if that happened to a client like yours with a situation similarly, I mean, we jump on it. We call everybody we know, we call in favors, whatever it takes to make sure that person gets taken care of.
It's been a long week. I've had
So that's where that question's coming from.
So yes, I was an advocate this week. And,
Okay, good.
And I still feel like the headache is still right there, but we got it done.
Good.
So
You were talking to me recently we were talking about this very thing in preparation for this show, and you were like, "Oh, I got a great one. I got a recent story. I think it was about someone and some kids."
Like the kids.
Yeah, it was a similar example of someone that called you and you went to bat for them and
Sure.
made a whole bunch of calls.
Sure.
And I mean, it sounds like every story I've ever heard from you. You're like, doesn't matter what time of night it is. You know, the service doesn't sleep, so to say. And that's the difference in that and the website.
Right.
You know, the website's full of information, but the website's not going to be like, well, you've been looking at 3 different places to live. Let's go ahead and be proactive and find you know.
Right. And no, that's a good point. And yeah, so I deal with this all the time, and it's always sitting with the folks, understanding. So I'm, as you both do, I'm sure, I'm building relationships not only with my clients, also with their family, also with the medical groups and their account executives. So they have folks that come out and they do trainings, and you know, I do my best to build relationships with those folks, so that when I do need something like this, they can jump on it. You know, you need to have a point person at every carrier. On top of that, they also have broker support. Every single one of them has somebody that I can call, that I can trust, that if I tell them what I need, they're going to find a way to make it work.
Right.
So, but then if you have somebody live too, just not on the phone, even better. So,
I mean, someone to go to bat for you is huge, you know, especially in a time of urgency. And the fact that, and correct me if I'm wrong, but the fact that whether a consumer goes out and purchases insurance or makes an election through a website or through a licensed professional like you, there's no difference in cost to the consumer.
not at all. So there is
That's
no
mind-blowing.
difference in cost.
Wow.
And the other thing, they think, well, maybe I'm getting a lesser plan, right? So if I didn't pay for it, well, maybe they gave me something lesser so they can pay you for it. So the benefits are the same. The benefits are the same whether you go through me or the carrier. The only difference is that you're getting a lifelong advocate, like we've always said. So I'm going to look out for you.
Mic drop.
Totally. Yeah, we're done. No, I'm just kidding. But earlier, you told me also that I heard a rumor there's more plans out there coming up. Or
Right. So
let's get more confusing.
yeah. So it can get very, very confusing. They've added at least 10 plans because, like I said, there was 68 this year in 2023. 2024, we already see 78 on Medicare.gov. So if they pulled some plans out and then added more, I mean, again, there's at least 10 additional plans. But like I said, you go to Medicare.gov, you put in your information, it's going to show you everything in order based on cost. Then it's just what you want.
Well, you mentioned too that large healthcare providers or systems here locally, like UCI, has changed who they accept too. So this is there's a lot of changes.
Yes, and you're right. So we were talking about how UCI was no longer accepting HMOs.
Right.
So that's important. if that's where your doctors are, that's your hospital. If you're on an HMO, you probably want to look at something different. And in 2024, we're talking about San Diego, Scripps is no longer taking HMOs.
Who I have.
Right. So we need to
I
take
got
a
some
look.
work to do.
We need to get to work and look and see what other options there are. And when it comes to Medicare, I think we were talking about, Medicare 101, just overall information. When you're looking at Medicare plans, you have those 78 plans. Those are just Medicare Advantage. Okay. That's Part C. Of those, 13 of them are PPO. So that means a large amount of those are HMO. Well, none of those will be able to go to UCI nor Scripps. So now we're looking at those 13 PPOs, or you're looking at a Medicare supplement with a drug plan, which is totally different. And we want to make sure that people understand that. A Medicare supplement is not a PPO, and a PPO is not a supplement. They're two different ways to do your health care. And for all those folks that have had PPO, they understand that if they go in network, they pay a certain cost, correct? And what happens when you go out of network?
More.
You pay more, right? With a supplement, that's not the situation, because you pay a premium, and then, for instance, Plan G. So that's usually what people will accept or enroll in a Medicare supplement. There's a $226 deductible. That is it. So you pay a premium. It's based on age. So a 65-year-old may be paying about $140 a month. But as far as copays and coinsurances, once they've paid their doctors or lab work or physician fees, whatever they paid, has met the deductible of $226, the plan pays everything. And there's no network, no referrals, and you can go anywhere in the country that accepts Medicare.
So the difference is they're paying more on a monthly basis.
That is correct.
But $226 seems pretty easy to meet anymore.
Absolutely.
Interesting.
And $140 a month.
And that was through a supplement plan?
That's a supplement
not
plan.
Not the Advantage.
Not Advantage.
I learned something today.
Yes.
Wow.
For like a 2007 Hyundai Accent, you start payment, you can have that flexibility. That's insane.
Right. Where'd you pull that number?
Are you in the market?
Just always been fond.
Wow. Okay.
I had one back in the day.
Nice.
Well, let's talk about the thresholds, because periodically we get a call from a client saying, "Oh, I'm fairly disgruntled. They got a letter from Medicare that their premiums are going up.
Sure.
They're going up substantially.
Sure.
And it usually goes back to either the income for a certain year hitting a threshold, or maybe they sold a house.
Right.
So for that 1 year they have elevated income.
Correct.
And we've heard horror stories. We've heard Medicare premiums doubling, sometimes tripling. And no one likes to get that letter, but there's really not much they can do. So can you talk about the threshold?
Sure. So the numbers we put on the board, and basically the average American is going to pay $164.90 currently. So in 2023, their Part B is $164.90. That is for a single individual reporting less than $97,000, or a couple reporting less than $194,000.
So if a married couple is under 194, they both pay 164.
They both pay
Gotcha.
164.
Yep.
So currently, I have a situation where a couple met, they're getting married. He had a business, sold a business, but isn't making any money right now, right? So he is eligible for Medi-Cal, which pays his $164.90, but they're getting married. So she makes $155,000. As a single individual, look where she is.
Mm-hmm.
She's paying $329 a month, which
Right.
is double the average American. But now that she's getting married, that $155 is under the minimum threshold, so they both will pay $164.90.
Right. I got you.
She's in the same boat.
Right.
Whether she goes as a single individual at $329 or they're married and they each pay $164.90, their premium is still the same.
Interesting.
So, but those are the things you have to talk about. And like
Right.
you said, we talk to the individuals, we let them know what's going to happen, because you don't want any surprises. But to your point, if somebody sells a home, and that I've had that happen as well. So the client was paying the $164.90, and then she sold the home, and then 2 years later, so it goes on a 2 year. They look back 2 years on your taxes. She went from the $164.90 to $560 for Part B. So, I mean, I think that's probably about triple, at least. And then not only that, there's also a Part D.
Right.
So this is IRMA. It's income related adjustment based on your monthly gross income or annual.
And Part D is prescription,
Part
right?
D is prescriptions, exactly. And when you're at the minimum amount, again, it's $164.90 for B. And then on the Part D, you just pay your premium cost. So there's no increase. But if you go to the next bucket up, which is $97,000 and above for the individual or $194 for the couple, then they add on $12.20 a month.
Right. It starts getting expensive.
And it just continues to go up from there based on income. So, but what I do tell the folks, and I'm very honest, I said, look, I would love to be paying the highest amount for my Medicare.
There's worse problems to have, right?
Absolutely. I mean, if I'm paying the highest amount, which is $560 for B and $76 for D, so call it $630 some odd dollars, I'm making over $750,000 as a couple.
Right.
I mean, as a percentage, I have to believe that percentage of my income going to that is way less than the person making the minimum. You know what I mean?
Sure. Absolutely.
So I would take it.
Yeah. No, I get that. Wow.
That's crazy.
Yes, sir.
So obviously, the second time around on the show, you're very knowledgeable in what you're doing. Can you give us a little more insight? Why do you do this? As long as I've known you, you're a caretaker in a sense. That's where you and I, and definitely you, Ruben, we have this similar passion for that. It drives us. Like I wake up and I'm ready to help somebody. Does that come along in what you do?
I think so. Absolutely. I think I said earlier how, sometimes people are having to decide whether they're going to take a medication or eat that night. It's like, how great is it to not have them have to deal with that question? No, you do need your medications because that's how you, survive and thrive. And you are going to eat tonight because we're going to find a way to make it happen.
Yeah.
And so it's funny. I got a call from San Clemente Times. I don't know if I told you guys, but they're doing an insert for seniors, people who help seniors. So I was able to do a quick little interview last night, which was pretty fun. And he asked a very similar question. And it was, when you sit with somebody and their eyes just start to well up,
Totally.
and you've hit a nerve, a great nerve, that something is going to be better tomorrow than it was today. And it's because of what you did.
Wow.
I mean, how is that not driving you to get up every day and do it again?
That's I've had clients. I remember at our old firm, I was in a meeting with one of our colleagues, and the client, we were working on her financial plan, and she was about to retire, and literally the floodgates. She knew it was coming. We've been working on this for a decade, and it was finally here, and it was one of our first meetings with our colleague, and he's looking back going, what is happening? But to me, that's why I do this job.
Sure.
I can tell, it's clear, I felt how much relief she had.
Right.
It's like, that's why I do this job.
And I think we might have said this last time, right? Mark Twain's quote, which he says, what are the two most important days of your life? The day you're born and the day you find out why. It's like we found that.
I love that. Yeah.
So
it's like the Roy Firestone. I'm not going to cry, Roy. I'm not going to cry.
Well,
it's like the Jerry Maguire.
Exactly.
I wasn't going to cry.
Yeah. I say, well, I've got a letter here from the Arizona Cardinals that says you've been signed for 5 years, whatever $1 million.
I love it.
Exactly.
Why don't we have that kind of relationship?
Get out of here. Yeah, absolutely. Wow. So we don't want to be Bob Sugars. That's why we get up every day.
Yeah. You got to enjoy what you do. Yeah.
Totally.
For sure.
Well, leave us with, is there anything that we're missing here in the future coming down? Is there rumblings about any changes that are coming up in future years with Medicare? Or do we know what we know?
Sure. I think we know what we know outside of that Inflation Reduction Act, which, again, I mean, there are limits currently for medical. So your plans have them, Medicare has them. So meaning that no matter what happens to you in any given year, God forbid something major, there is a cap. So with prescriptions, they've never had that. So it's nice that they've done that because, that's a really important thing. There's people who take expensive medications. That is a change, and people need to know and understand that because it will affect how we choose things for the next couple of years. Like I said, what I've been seeing is that Medicare Advantage, that's okay. It's not been affected too much, but Medicare supplements, their drug plans have doubled, sometimes tripled in premium for 24.
Yeah.
And we don't know what it looks like for 25.
I think what we know is that Medicare and pricing and options available is going to be constantly evolving.
Sure.
It's constantly. what we know is that there will always be change.
Right. And I don't know if you both knew this, but Medicare supplements do increase year over year based on your age. And the couples that I talk to are in their 80s, approaching 90s. So their premiums are getting to the point where they say, I think I really need to look at my other options.
Right.
So maybe Medicare Advantage does make sense for me.
Right.
So it really comes down to personal need and income.
And at that stage of your life, do you have the capacity? Do you have the patience to really take on a project like that? That's a major decision.
Right. Right. Yeah. And the people I met with yesterday, they said, I don't.
Right.
I don't want to study the 78 plans. That's your
Honestly,
job.
that's why we have a job too. Clients, some of our best clients were great business people. They make great decisions. Yeah. When it comes to unwinding their wealth and creating a distribution strategy or how to transfer wealth as a legacy, that's why they need us. They need that professional. They need that plan.
Yeah. Well, and they were high-level individuals in a business, and that's why they come to us, because they know how to delegate. Right.
Good point.
See their blind spots, right?
Yeah.
Oof, good call.
Yeah.
Well, look, Jerry Maguire might have been the lord of the living room, but you are truly the master of Medicare.
Awesome.
And we
I love
appreciate you being here.
Absolutely.
To our viewers, we plan on having Carlos on at least quarterly is probably a good idea, or as often as we need to if there's changes.
Major changes, sure.
I would love to.
There, so you're the best, buddy.
Thank you, guys.
Yeah, we appreciate it.
Appreciate you having me.
having here. And to our viewers, if you're living your life and you have your health, you're the wealthiest person in the world, and we appreciate you joining us in our digital barbershop. Thanks so much.